What are the structures contributing the tonsillar bed? We know that the tonsil is situated in the oropharynx. So the anterior pillar is formed by the palatoglossus muscle. That anterior is you have the tongue. So glossus related to tongue. So anterior pillar palatoglossus. Posteriorly, you have the pharynx. So posterior pillar palatopharyngeus. You can remember it like that. Anterior is palatoglossus, posterior is palatopharyngeal. Superiorly, you have the soft palate. Inferiorly, there is a posterior part of the tongue or base of the tongue, and the base of the tongue is separated by from the tonsil by a sulcus known as a tonsillolingual sulcus. Medially, you have the pharyngeal opening, that is the pharynx. Laterally, you have the tonsillar bed. So lateral surface of the tonsil, there is a thickened structure that forms the capsule of the tonsil. Then you have the loose areolar tissue or a space known as peritonsillar space. After this space, there is a Pharyngobasilar fascia. So the space between the capsule of the tonsil and the Pharyngobasilar fascia is known as a peritonsillar space, which contains a loose areolar tissue. It is where the peritonsillar abscess happens. So the Pharyngobasilar fascia connects the pharynx to the base of the skull. That is why it is known as Pharyngobasilar fascia. After the Pharyngobasilar fascia, you have the superior constrictor muscles. Superior constrictor muscle constricts the pharyngeal inlet, so superior constrictor muscle. Inferiorly, you have the Styloglossus muscle. The superior constrictor muscle is covered by the Buccopharyngeal fascia, and it is the anterior-medial boundary of the parapharyngeal space. So, Buccopharyngeal fascia, Styloglossus muscle. You know that there is a space between the superior constrictor and the middle constrictor where the glossopharyngeal nerve, stylopharyngeus muscle, and stylohyoid ligaments exit. So, glossopharyngeal nerve is also related to the lateral aspect of the tonsil. Then other structures that are related laterally to the tonsil are the facial artery. So the facial artery comes and gives branches into the tonsil. The facial artery branch of the tonsil enters in the lower part. The capsule of the tonsil is loosely attached in the superior part, but in the lower part it is tightly attached to the pharyngeal muscles, and it is attached to the tongue via suspensory ligament. So this is near this only the tonsillar artery enters the tonsil. So when we dissect the tonsil superior to the lower third, it is easy. Then we have to dissect cautiously because the artery enters there. Then lateral most you have the angle of mandible and the medial pterygoid muscle. Other lateral relations are you have the internal carotid artery. The internal carotid artery is located around 25 millimeter or 1 inch lateral to the tonsil. So any pulsating tonsil can be a presenting symptom of an internal carotid artery aneurysm. You also have the styloid process related laterally to the tonsil. So any elongation of styloid process or the calcification of the stylohyoid ligaments, you can palpate in the inferior wall of the tonsil. Capsule, 3 muscles. Superior constrictor muscle, styloglossus muscle, medial pterygoid muscle, 2 fascia, Pharyngobasilar fascia and Buccopharyngeal fascia, and you have an artery, facial artery. Then you have vein, that is tonsillar vein, nerve is glossopharyngeal nerve.